Hey everybody. Today we're going to be talking about a disease terminology, the study of disease and risk factors. So when we start talking about diseases and what diseases are, there are a lot of different components about how we talk about diseases. We talk about how you get the disease, the study of where the disease comes from, the study of how the disease spreads, all of the things like that. So we're going to be talking about some of those things today. First of all, we're going to be talking about pathology, which is the study of the actual cause and effect of the disease. So, pathology comes from the Greek words pathos, which is disease, and ology, which is study of. So, pathology is a branch of medicine that deals with the examination of body tissue samples for diagnostic purposes. So, what essentially happens is, let's say you feel sick or you have a lump in your body. What your doctor does is that they take a biopsy or a sample of your tissue, and then they give it to somebody called a pathologist. The pathologist then takes a look at your tissue sample and compares it with samples of healthy tissue, and they can determine what is wrong with your tissue and where your disease lies. So, pathophysiology specifically is a study of the disordered physiological processes associated with the disease or injury. So, essentially, it's the study of how your tissues and how your body reacts to something that is not supposed to be there, which is disease or injury. So, physiology is function. Okay. So, pathophysiology would be how disease affects normal body functions. So, if you see this picture here, on the left side, you'll be looking at lung tissue here. So on the left side here, we see normal tissue, okay? And on the right side, we see tissue that's been affected with asthma. And obviously you can see that there's a big difference. So pathogenesis, again, pathos, right? Which refers to disease, and genesis, which is the beginning of. So pathogenesis focuses on the pattern of a disease's development. Okay, so essentially, what what biological mechanisms leads to you getting that disease and being sick? Okay, pathogenesis can also be described by these three words. I'm pretty sure you've heard of them before. There's acute, which is sudden onset, so you suddenly get it. There's chronic, which lasts 3 or more months. And then there's recurrent, okay, which is return of a sign, symptom, or disease after remission. So what that means is you get it, you get better, but then you get it again. Okay. Now, this is the pathogenesis of infection of an example of a disease. So if we look, step 1 is entry. So how the pathogen gets into your body. So here it enters through penetration, inhalation, or ingestion. 2, attachment. So how the pathogen attaches to cells or tissues to get affected. 3, multiplication. Okay, how the pathogen multiplies in your body so that it can spread. 4, invasion and spread. Pathogens spread to surrounding tissues. 5, evasion of host defenses. So once the pathogen spreads to the surrounding tissues, it launches an attack against the immune system. Okay. And then step 6, damage to host tissue. So depending on how bad the disease is, it can cause a lot of long lasting issues. So that's an example of the pathogenesis of an infectious disease. So remember, infectious means that you can get it or that you can spread it. Next thing we're going to be talking about is the signs of a disease. Okay. When we talk about the signs of a disease, it's any objective evidence of the disease. Okay. So for example, if you have blood in your stool, that's sign of a disease. Okay. Another example of signs of disease could be a change in your normal vital signs. So your vital signs are your pulse, which is your heart rate, your respiration rate, your blood pressure, and your body temperature. Okay. So obviously, I think you guys know when you're sick, when you go to your doctor's office, your doctor takes your pulse, Okay, they take your respiration rate, they take your blood pressure, and they take your body temperature. And if any of those things are out of whack, then they know that it's a sign of a disease and that you're sick. Now, symptom of a disease is a little bit different. A symptom is a physical or mental feature that's regarded as indicating condition of a disease. Okay? So symptoms are subjective to the patient. What that means is they are to you. Okay? They are what you feel. So they can either be acute, they appear suddenly and then suddenly go away, or they can be chronic. So they develop slowly and last for a long time. Okay? Now, etiology is the study of all factors involved in causing a disease. So those things can be like the weather, how many people are in a room, what kind of disease is being spread, does it affect young children versus older people, things like that. Okay? And diseases can be communicable, which means it can be transmitted from one person to another, or it can be non-communicable. Okay? Now, epidemiology is a study of the occurrence, distribution, and transmission of diseases in human populations. So right now, when we're talking about the coronavirus, the people that are studying it and how it spreads to different people, they are called epidemiologists, and that's what they're doing right now. They're studying how the virus spreads from person to person and from region to region. So when epidemiologists study a disease, they use some words called endemic. Okay, now what endemic means is that the disease is native to a local region. Okay, so it's localized in that region. So if the disease spreads to a lot of individuals, okay, in a similar region, it's called an epidemic. Okay, and then the biggest outbreak of a disease is called a pandemic. Okay, pandemics are epidemics that affect large geographical regions. So right now, COVID would be considered a pandemic because it's affecting almost all of the regions of the world. Okay, and then lastly, what we're going to be talking about are different risk factors for different diseases. Okay, so risk factors are things that can increase your chances of getting the diseases. So one is genetics. Okay, so genetic traits are inherited from your parents, and some risk factors for genetic disease can be, for example, fair-skinned people are at greater risk for skin cancer. Another risk factor for disease is age. So certain diseases affect younger people more than older people, and some diseases affect older people than younger people. So I'm sure when you guys were kids, a lot of you got ear infections when you were kids. That's because they're a lot more common to infants, and you guys will probably get less ear infections as you get older. I don't think I've had an ear infection in 20 years. Another risk factor is for disease is lifestyle. So I think this is one of the biggest things that you can change to reduce the factors for disease. So lifestyle, it's the way we live and work, okay? And things that we do in our daily lifestyle can increase our chances for disease. So for example, if you work out a long time in the sun without sunscreen, you're at a higher risk for skin cancer. Let's say if you do a lot of drugs with needles, right? Sex, drugs, and rock and roll, as they said, all of those things can increase your risk of HIV and STD infections. Okay, another thing can be smoking. Smoking is a lifestyle choice. Smoking obviously increases the chances of lung cancer and emphysema and things like that. Okay. And then another risk factor for disease is stress. So stress, you might think is in your mind, but stress is a reaction to a stimulus causing physical, emotional, psychological disturbances. So it's not just in your mind. Stress can cause a lot of physical manifestations. Okay. can cause you high blood pressure. It can cause you ulcers. Okay. If you're stressed over a long period of time, it can weaken your immune system. So I think you notice that during times of stress, you get sick more easily. So that's why it's important for you guys to kind of figure out how to deal with your stress as you go along. Um, as you go through life, there's a lot of sources of stress. So you have to kind of um, think of strategies or look up strategies to be able to deal with them as you go along. So another risk factor is exposure. So obviously, if you're exposed to the disease, um, let's say mosquitoes carry malaria and Zika virus. Obviously, if you're not in an area where you're exposed to those mosquitoes, you'll be at a lower risk for the disease. And then lastly, risk factor for disease, pre-existing conditions. You've probably heard of this. I think politicians have been talking about this a lot over the past couple of years. So pre-existing conditions are any previous illness or injury that can put us at greater risk of developing other illnesses. So an example is AIDS, right? So AIDS is a pre-existing condition because what can happen is it makes it likely that you're going to get other diseases. For example, AIDS is an autoimmune disease, and it opens you up to being killed by something as simple as the common cold. Okay. Another pre-existing condition could be diabetes, for example. Okay. And that's it for today. So hopefully you learned something today about disease terminology, and it hopefully enlightens some of the conversations you guys have and some of the videos you guys watch. Thank you.